Good afternoon. I'm gonna try to walk around a little bit, so that I don't stay behind this so that everyone can see. So my name is Michal Plavsa. You can call me MJ. I am from Ohio University. I know we talked a little bit yesterday. I believe it was Kelly who was sitting here. She was talking about doing a study with the Ohio State University. I am also an alum from Ohio State, but this is a different part of the state where Ohio University is. So I want to talk to you today a little bit about a study that I did as part of my PhD dissertation, a contrast review of community health worker training programs and standardized education. I'm going to try to do a little bit of interactivity. I know we're tired. I know we've been sitting, and I brought some goodies all the way from Ohio, which is over 7,000 miles, and I need the space in my luggage to go home because I want to buy some cool stuff, right? So I want to give them all out. So here we go. This is a little bit about me and Ifioma. Yeah. I also have my husband here with me today. Yes. He came again 7,000 miles to support me in doing this. So I'm very grateful for him to be here. I have over 30 years of public service. Not all of it has been in academia. Some of it has been with law enforcement. I was not a law enforcement officer, but I worked in a law enforcement office. And most of it has been with budgeting with local and or state government. So I did my PhD in individual interdisciplinary program, and my focus of study, and we've talked about this a little bit, is health literacy and community health workers. And we're going to talk a little bit more about health literacy tomorrow, but we're going to talk about some standardized programs that I reviewed today. The Master of Education that I had was a focus on educational administration and instructional design. And I am a certified community health worker, as well as a health literacy specialist. I'm a travel enthusiast, so when I saw this conference in Singapore, all I could say is, hey, baby, I really want to go to this conference because it's in Singapore. And he's like, great, what's the problem? I'm like, no problem, let's go. So, have a passport, we'll travel. We'd love to go anywhere. And for those of you who like to explore, are there any scuba divers in the room? Well, I'm also a certified master scuba diver trainer through PADI and SCI. So, has anyone heard of Jacques Cousteau? Yes, yes. So Jacques Cousteau was a scientist and one of the first. He made scuba diving possible, not just for Marines, Army, Navy. He made it for people like you and me. Non-commercial, and one of the things that I appreciated about Jacques Cousteau is he said, in order to observe a fish, you must become a fish. So we talked about that a little bit yesterday when I believe it was Jane, Dr. Jane, talking about ethnography. So in order to be an ethnographer, you become part of what is happening. So this is just a fun thing that I did on wordcloud.com with some students that I was teaching in a program for community health work. I asked them what comes to mind. How many of you are familiar with community health workers? And you may call them. Excellent. I see all those hands, so come see me afterwards. If I actually try to come down and bring pens, I'm going to trip, and that's going to be more entertaining than the presentation. So anyway, I collected words. I would ask them the whole time, what is it that you, when you think of yourself being a community health worker, what is it that you're going to do? And these are their words. So, promotores of food, community behavioral health worker, that's what the CBHW is. All of these things, they were their words. So in this study, I wanted to look at 3 states. So I looked at Ohio, Indiana, and West Virginia. I wanted to look at the different programs that they had, what they were doing well, what they could improve on. I don't really want to call them weaknesses. I want to call them opportunities for improvement. But I also wanted to understand, what community health workers did in different environments, in different regions. Because the United States is big, right? There are 50 states, and then we have territories, but even in one state or one part of the state, or even organization to organization, community health workers do different kinds of work. And I also wanted to just contribute to the advancement and keep the conversation going about training and standardized education. So what I looked at specifically were curriculum standards, state to state. And again, this was a public university in Ohio, a public university in Indiana, and a public university in West Virginia. I wanted to know what the curriculum standards were, what their certification requirements were, if they had them. And when you see pathways up there, it specifically means, what can they do with this certification? What was the next step? If they wanted to take the next step, what could they do? I wanted to look at supporting organizations for community health workers, if there were any. And this is the sustainability of these programs within the universities. So here is a map of the United States. I know there was someone yesterday specifically asking me about Ohio, and that in red is where we're looking at. So as you can see, there's an awful lot of space here, but we're just looking at those specific states in that region. So something that I wrote down, two of the states are part of the Appalachian region, if any of you have heard of the Appalachian Mountains, but specifically West Virginia is the only state that is completely within that region. But a little tidbit for those of you who are from Europe or Africa, the Appalachian Mountains extend from Canada, which is north, all the way down to Alabama, which you see down in the lower left-hand corner right above Florida. But during a little history lesson here in geography, when Pangea, before all the land separated, the same mountains were part of the Scottish Highlands, which are in Europe, and the same mountains in Morocco, which are in Africa. So I thought that would be something to unite us, something that we could think about that we all have in common. So program number 1, we'll go through these really quickly, but program number 1 that I wanted to talk about was in Ohio. Certifications for community health workers are through the Ohio Board of Nursing. You had to be age 18 and have a high school diploma or a general education diploma. In order to be certified, you also have to have a background check. You have to pass a background check, and that is a requirement from the Board of Nursing. There are standardized education requirements, which means that anywhere in the state of Ohio, if you go through this training program, and you see later on, there are 14 approved training locations or organizations who provide the training. All of them train, they have the same standardized information that they have to teach. So they also need 100 hours of classroom instruction in addition to a practicum or field work of 130 hours. There are continuing education requirements, which there are 15 hours, and I believe one of those is ethics, and another one is category A, which in Ohio or in the United States is ethics and boundaries. The certification is good for 2 years. It is a comprehensive training, which means you don't have to go back and get advanced or the next level. Everything is within this training. And it was developed in 2015. So another thing I want to point out is that as we go through these, I want you to notice the differences in the green boxes. Yes, I have one is strengths, one is challenges, but look at the differences as we go through and see what you notice. So some strengths of the training program number 1, which was in Ohio, is that they exceeded the curriculum standards. And what I mean by that is whatever the Ohio Board of Nursing said you needed, this program met and or exceeded. The reach was through Southeast and Central Ohio. We talked about pathways. This served as a pathway for nurses, social workers, care navigators, insurance specialists, and those who work for Medicaid. Another highlight or strength in this program is that they were expanding pilot programs to work with throughout high schools. And some challenges I specifically wanted to point out is the ambiguity in the continuing education hours, whether it would be with nursing or social work. They can use both, but there's such a distinction between nursing and social work, and that there were limited continuing education offerings specific to community health workers. So I'll quickly go through training program number 2, which was Indiana. Again, they have the age requirement and the high school diploma requirement. They are certified through Community Health Worker Organization in Indiana. There were 4 vendors who were recognized, though notably the institution that I reviewed for this, they were not a vendor. Continuing education was recommended but not required, and they were established in 2022. So some strengths here, again, they serve as pathways and they do have curriculum standards and certification, but the seats were limited. That was something that I noticed, and the cohorts were prioritized by community needs. This particular program also relies heavily on support and grants. And the last one we'll talk about was in West Virginia. Again, there was an age requirement, high school diploma. It was an online format. They did have 3 levels of training, and the initial training was free unless you wanted the actual certificate, and then you had to pay a fee. But there were no standardized curriculum or education throughout the state. There was no organization supporting. It was just this one university who was really trying to do the work. And although they were developed in 2011, they were the least far along due to funding and just not recognizing what community health workers could do. So this is just a little chart that I made, just how far and how different, again, talking about the United States, just the 3 states that I reviewed, the only thing that they all had in common was an age requirement. There was no other standardized curriculum or format that we have. So I've taken a lot of time talking about these. I get excited about it. It was really in depth for me, but I would love it if you would like to use the QR code just to tell me about what you do know. You don't have to be an expert in this or teach the program, but tell me how it is. And this is just for my information. I promise I'm not going to spam you. I'm not going to try to get you involved in other programs. But I would love to know about community health workers in your country or in your region. So I'll leave that up for a minute and I'll tell you, hey, again, I have all of these things that I would like to give out. So please take a look at those. And thank you very much for your attention today.